right, so welcome to Burlington on the Spot, Dr. John Fox.
Thank
We
you.
we're on site today in Hugo, Colorado at Lincoln Health. Wanted to start, first of all, thanks a lot for doing this. We really appreciate it. Wanted to start out with a little background on your history and how you ended up here and how you became a doctor.
Well, I'm from Ohio and decided that I really like the dry weather out here. Came out here to do my residency back in 1984.
Wow.
First practice was down in Penrose, Colorado. Turned out I'm a much better doctor than I am businessman, and so I moved up here in 1990, about a month before the tornado hit Lyman, because I, like I said, I'm not a good businessman, and I needed someone that could take care of that end of the practice.
Gotcha. And then now you're the Director of Health and Clinical Services. Is that correct here?
So I am, I don't know what my title is. I am the County Health Officer, I think, is how I'm listed officially. I'm on the medical staff here. So Dr. Olson is the Chief of Staff. I actually am in charge of the Home Health and Hospice Department.
Okay, great. Yeah, and I mean, I would imagine things have changed quite a bit, obviously, over the last 6 months. Have you ever seen anything like this in your entire lifetime?
Well, some people think I might have been around in 1918.
Oh, for Spanish?
For the Spanish flu pandemic, but really I wasn't. So, no, I have never seen anything like this in my lifetime.
Gotcha. And then, so we were kind of talking before we started about masks. It looks like your mask, you got what, a custom mask there with some fish, possibly?
Yeah. Yes.
And then you brought something interesting up before we dive into our COVID questions. You mentioned that how hard this creates things for patients, for disabled. Would you talk a little bit about that? That might be something people don't, get exposure to every day.
Well, one of the things that it's made it difficult with my hearing impaired patients, because a lot of those people depend upon lip reading.
Oh.
And even my older patients, as we get older and get a little bit more hard of hearing, even though we don't realize it, we do start to read lips, and we spend more time looking directly at that person's lips as they're talking. And when you can't see that, you lose a lot oftentimes. And when you're hearing impaired, you lose pretty much everything a lot of the time. So they do make a plastic or a clear mask that they can see your lips move, and it's supposed to really enhance communication with hearing impaired patients. And I think it'll help with some of the elderly patients as well, who, whether they know it or not, do read lips some.
Right, 100. I hadn't even thought about that. So until that happens, how are they getting through that right now? I mean, how do you even? What do you do? Would they just make sure they keep a distance and just?
So with my hearing impaired patients, they usually have another family member with them.
Gotcha.
Who will sign.
Okay.
I wish I knew how, but
No, but that makes sense. I mean, with the signing, but I just didn't even think about that, because even on a day-to-day basis, when you're communicating, you see people smile, you can read their reaction, everything. So, it makes a big difference.
Yes.
So,
and you can usually tell what kind of mood a person's in without seeing the rest of their face, but being able to understand lips and the cool thing about the mask is no one can see me when I stick my tongue out at them, so it comes in handy sometimes.
Or they can't see if you're smirking or frowning, so gotcha.
Yeah, the rest of my face might give that away.
Gotcha, your eyes. Well, cool. Well, so to jump into some of the questions that we did, to preface this, we reached out to the community on Facebook and friends and family in Burlington and the Eastern Plains, said, hey, what kind of questions do you guys have? We have an expert sitting down here, Dr. John Fox. Hit us with what you got. So that's what some of these questions are.
Sure.
One of the first one is hydroxychloroquine. And the question around that is, there's been so much information, right? Without any kind of politicalization of it. I mean, what are your thoughts? I mean, does it work? I know information changes daily, but what do you think about that as a treatment?
So the honest answer is I don't know.
Okay.
But one of the things I've tried to do from the start, because there's been a lot of information and misinformation
Yep.
regarding this disease. And usually the honest answer is we don't know, but no one ever trained us to say that in medicine, so we have to give you some sort of answer. With this particular drug, it probably is marginally effective, if at all. And there are some ongoing research trials that are still looking at it. There are some small trials, and again, when it comes to research in medicine, small numbers are not good for determining how effective something is or isn't. And so there are a couple of small trials that said it wasn't effective. There are still some people that are convinced it is, so there are some ongoing trials with the drug. Personally, if I got COVID, I would not want it. There are better drugs out there. There's some steroids. Remdesivir has some benefit. There are a couple of vitamins, zinc and thiamine, that have been used. So there are things that we do know can be beneficial that I think are going to be working better than
Gotcha.
hydroxychloroquine.
Yeah, so interesting. So if you were sick, you would go that route. Some of the steroids, and I saw that yesterday, like a big study on the steroids that are being showing effectiveness.
Yes. And again, you have to put it in perspective. It's not for someone who's not got any symptoms. It's not for someone who has really mild symptoms, because it doesn't show any benefit and may actually have some detriment under those circumstances. But definitely for the person that's hospitalized, it decreases the amount of those people that need to be on ventilators in the ICU, and it shortens the time that they have to be on a ventilator if they do have to be on a ventilator. So under those circumstances, that's when we look at using those sorts of medications.
Okay. Thanks for clearing that up.
Sure.
Yeah. So question number 2, masks, which we just kind of talked about, is masks and mask wearing. What are your thoughts on the effectiveness of that? And specifically, we were talking about, this is a tough one, but it's talking about restaurants. You hear this all the time. If I walk into a restaurant, even when I was climbing in Salida, you go into a restaurant, wear the mask, then you sit down and take it off. And in some places, I think one of our producers, she was up in Chicago, and they're making you wear it when the server's coming to the table. So I know it's different in every state. But what is your take on that as far as effectiveness?
So from my standpoint, masks are really the key way that we have to combat this virus right now. Hopefully we'll have some immunizations here in the not too distant future, but right now masks are our main weapon against this disease. We know, so one of the things about this mask that I have on, there are 2 layers of cloth, and then between those 2 layers of cloth, there's a filter. So when it comes to masks, one really thin layer of cloth is not going to protect you very well. You have on a surgical mask, that's a good mask. N95 masks are the best masks. But the deal with masks is this. If we're both in this room and one of us has COVID and the other one doesn't, and we're wearing masks, and especially if we maintain that 6-foot distance, the chances of the one of us that's not sick catching that disease is right around 1%. If neither one of us is wearing a mask, it's 70%.
Wow.
And so there's no question that masks decrease the incidence of transmission of the disease. The other interesting thing, because they told us from day one, don't wear masks.
Right.
Save those for the medical personnel.
Yeah.
They don't help. They don't prevent the disease. Well, okay, let's think about this. If they don't help prevent the disease, then what are the medical people doing wearing them?
Right. No, that's a good point.
They do help, and we didn't have enough masks to go around. That's not an issue now.
Good, yeah.
And if you don't want to wear a plain blue surgical mask, get someone that can, or if you can sew, make it yourself. Make something fancy. You know, I love to fish. That's why I got fish on my mask.
Yeah.
And I happen to know the person that made this, and it's it's not custom made, but it's made to my specifications. So the 2 layers of tightly woven cloth plus the filter, I'm as protected as you are.
Or probably more. I mean,
Yeah.
it sounds like if you have that filter, and I mean, and you should be. I mean, you're in the hospital, patients. It makes sense.
You know, I may or may not be more, but we're at
Right.
least both very well protected from the disease process. We know if I'm sick, well, even if I'm not sick, it doesn't matter. If I sneeze, I will produce 100,000 droplets that will travel at 100 miles per hour, and they'll travel 30 feet.
Wow.
So if I'm sick and I sneeze and I'm not wearing a mask, you guys ain't far enough away.
Gotcha.
You're wearing your masks, that's good. But the fact of the matter is that if I'm sick and same thing and I sneeze, those droplets are not going to travel any more than 10 inches away from my face.
Okay.
It's very much about protecting other people. You know, if you don't care about the other person, don't wear a mask.
Right.
But if you care about them, please wear a mask. The other bit of information that's interesting is if you are exposed and you are not wearing a mask, your chances of getting severe disease, symptomatic hospitalized disease, are in the range of about 60%.
Mm-hmm.
If you are wearing a mask and you get exposed and you do get sick, your chances of getting that degree of illness are less than 20%.
And that's because of the viral load?
That's because of the viral load, exactly.
Okay.
Yes.
So
So masks protect you. Now, to your specific question about restaurants, so they talk about exposure, within 6 feet for more than 15 minutes, but that's cumulative exposure. And so the concept in a restaurant is you can't eat with a mask on.
Right. It'd be hard. Yeah.
I'm watching them eat candy. Okay,
they have masks on. They're doing it.
and they're moving the mask anyway. But you can't really eat with masks on. And so for a restaurant to be open, we have to take some additional precautions. I was just on a trip to Wyoming, and I was in a small town, walked into a restaurant, and every table is filled and nobody, staff, diners, no one's wearing a mask. Now, it's interesting because this restaurant is selling masks with their logo on. And I'm like, well, why the heck wouldn't you wear it and advertise your restaurant at least? But no, not a single mask in the place. When I walked into that restaurant, we got our food to go. I walked into another restaurant in another town. We go in with our masks on, sit down. No one is at any of the other tables around us. All the wait staff at the front desk, all the customers are wearing masks. We take the masks off to eat, put the masks back on when we go to the bathroom. We had the masks on when we were ordering with the waiter who had his mask on.
Yep.
Where do you think I am more and less likely to pick up COVID from those two scenarios?
Yeah. I mean, that makes sense. That's a pretty easy choice. Yeah.
And what this restaurant had done is they had shortened their menu. It's a restaurant I've been to before. They'd shortened their menu. And what they were doing was turning over their tables a little more quickly than they usually did so they could get a couple extra sittings in to try to increase, make up some of that lost volume. I care very much about businesses.
Yeah, I can tell that. Yeah.
I want businesses to be open and be functional and make money during this. And the way we do that is by wearing the masks.
I totally
Really
get what
and
you're
truly.
saying. Yep.
With restaurants, yeah, you got to take them off to eat, but there's a proper way to do it, and there's a not so proper way to do it. I'll go back to that second restaurant anytime and sit down and have a meal. Still go to the first one, but I get carry out.
Yeah. Well, and I think we're lucky because this is the first time I've met you, and I didn't realize you were a businessman that, ended up ultimately in the medical field. But that makes a difference, right? I mean, because the reason I'm saying that is what you just explained, those two scenarios. I understand the difference. And I also get that it's not a perfect solution, but we're trying to keep our businesses open and find a way to meet in the middle. It sounds like. And
there's a way to do that if people are willing to wear a mask.
Okay. Well, thanks. Yeah, thanks for answering that question. Sure. Number 3 we had was the CDC. Over the weekend, they had released new numbers. And their guidance on that, which you probably saw, was saying that I believe it was 6% of the fatalities to this point were directly attributable to COVID only with no other issues or underlying illness. What is that? I mean, what do we make of that?
So we're always, well, again, this is politics that's
right.
getting involved. We're always looking for ways to make things look better. And the fact of the matter is that doesn't reassure me much at all, because what that says is the majority of people that are dying from COVID are people that have underlying medical conditions.
Okay.
So the older, the sicker you are, the more diseases you have, the more likely you are to die when you get COVID. And the argument is, well, they had underlying heart disease and they got COVID and they had a heart attack and died, so they didn't die from COVID, they died from a heart attack. No, they died from COVID, because had they not gotten COVID, they would not have had that heart attack that killed them.
I think I see what you're saying. Yep.
So it's again, we're playing politics, and we're playing politics both ways. Some people are trying to make the numbers look worse. Some people are trying to make the numbers look better.
Yeah.
Gee, I had COVID and I got in a car wreck and died, so I died from COVID. No, you didn't die from COVID. You died from a car wreck. But the fact of the matter is, and we've known this from early on in the disease process, that people with underlying medical conditions, heart disease, lung disease, liver disease, kidney disease, people that are overweight, people that have high blood pressure, their degree of illness and their likelihood of dying from this disease is higher than, say, a young, healthy 20-year-old. And that's basically what the CDC was saying, was just supporting that fact. It's not that those people didn't die from COVID, because if they hadn't had the COVID, they would not have died. Not then. We're all going to die someday, and
right.
Most of us are going to die of heart attacks, and a lot of us are going to die of cancer and strokes.
Yep.
But we weren't going to die yet until the COVID intervened. So, did we die from our heart disease or did we die from COVID? I think we died from COVID, personally.
Okay.
Because we're talking about right now, right this minute. And if you look at overall death rates, so the number of people that have died, it's higher than what it was before COVID.
Okay. Like year over year? And
you're right.
Okay.
Right.
I didn't know that.
Yeah.
Well, I think you can understand where these questions come from, because like you said, you have both sides trying to with media and clicks and making their money and then pushing their narratives on both sides. That's why we're just trying to sit down and get some transparency and hear this stuff, because it's confusing when you see something like that come out. Thank you for that answer.
And a lot of it comes from politics, and it sickens me that we let politics get in the way of a medical issue. But a lot of it also comes from, if you were of the mind that you really didn't want to wear a mask from day one, then you're still clinging to that. Well, they told us it didn't help. And now you've got this additional information that says, well, it's not going to kill me. With the fact that you're a 70-year-old with heart disease and lung disease, you better wear a mask because it's a lot more likely to kill you.
Especially if you're high risk in that category.
Exactly.
Well, and so one of the other questions, I'm flipping around on these, but I know there's a difference between cities too and rural, right? I mean, in some, just the way it is, the way people aren't packed together, they're out in the sunlight, maybe even more in a rural area. And one thing, when I talk to people around town, some of them have family that are medical doctors. Like one specific person has somebody who's in the ICU in Denver. And when they talk to them, their concern is so much greater. And it sounds like your concern. So that's the message too. Then if we're out in Burlington or Cheyenne Wells or whatever, and you don't feel that level of concern, but then she's in the ICU and her concern is very heightened, that it's nothing to mess around with. So can you speak to that? I mean, obviously you're speaking to that, but
there's no question that we are better at social distancing in rural areas. A farmer or a rancher that's out in their field, they're not going to get this from their cows. They're not going to get this from their dog. They may go weeks before they see another human being. So we do some of that naturally. That said, you can look at the numbers county to county, so even rural counties next to each other, and Kit Carson County and Lincoln County.
right.
Lincoln County has had 8 cases to date. The last I looked, I didn't look today, I'm sorry, but the last I looked, Kit Carson County had 78 cases. And when you look at that, I think a lot of it is related to some of the group gatherings that have happened. And that's where that social distancing comes into play. And especially if people choose to do group gatherings and not wear masks. So, we know we both have a lot of traffic going through on I-70, and a lot of our businesses service those customers. So we know that people are being exposed on a pretty regular basis. Along that, that people that work in the service industry, we know they're being exposed on a regular basis. So the fact that we can keep our numbers as low as we have is part luck, but part a testament to people paying attention to those guidelines and following those guidelines. And the closer they follow them, the fewer cases that are going to end up.
Okay. No, that all makes sense.
And it's no less serious a disease out here than it is in the city. In some ways, it's a little scarier out here because we tend to have an older, sicker population. We got plenty of young people too, but if you look at the average age and the average overall medical health of residents on the Eastern Plains compared to the city, we're older and sicker, and hence at higher risk if we get the disease. So I know there's a lot of people young people going to get the disease and not even know it necessarily,
right,
or recover very quickly. But we know, for instance, that 85% of people that have symptoms from the disease are going to have some inflammation of their heart. Most of those are going to clear up and heal very quickly, no problems. But the thing I worry about is some of the athletes that don't know, and they can have fatal arrhythmias. It's rare, but it can happen.
Like even younger population?
Yes, even the younger population. It's a condition called myocarditis. It's basically an inflammation of the heart muscle, and it makes the heart more prone to have abnormal heart rhythms, including potentially fatal heart rhythms. Again, most people, especially someone like me who sits around and doesn't do much, I may never know that I have that. But you get an otherwise healthy younger patient that is technically recovered from their disease. So they've, the 3 days without a fever. It's been 10 days since they started with the illness, that are released to go back, and they don't have any symptoms until they have that fatal arrhythmia and die. It's rare, but it can happen, and so it's not a disease that I take lightly for reasons like that.
Right. Well, and plus we obviously can't tell what the future brings. Like, how long conditions would be there if they start up again. Some people, I think the first person tested for the second time positive. I read that somewhere. So maybe there is an immunity once you have it. I mean,
so with immunity, we don't know.
Okay.
I'll start by saying that.
No, and I appreciate that candor.
I'll start by saying that. But what we think is that you do get some degree of immunity. May not last forever. But even some people that have tested negative for antibodies have been shown to have some resistance to a secondary infection, or a second infection with the same bug, secondary infection implies something else. Some people do get a second infection. We think that second infection, if they do get it, is going to be a lot milder, less severe, not unlike the first time most people get a disease, even something like strep throat. Mm-hmm. The first time a person gets strep throat, they're usually sicker than other times down the road because they do have a little bit of built-in immunity. Even though they may get it again and we need to treat it again, they may not get as sick as they do the first time they get that disease.
Gotcha.
A lot of the viral illnesses are that way. Some of the ones that you get over and over again. Influenza is certainly that way. We think that flu shots prevent influenza, but what they really do is they turn it into a much less severe disease. They turn it into more of a cold-like disease. So we're not as sick. We don't have the potential for bad outcomes like we do if we're not protected.
And that's because you've been introduced to a small viral load of it that you already defeated?
That's because your immune system has seen it before, knows what to expect, knows what to do. And we think that that's going to be the case with coronavirus as well, and specifically this strain of the coronavirus, the COVID-19. Mm-hmm. That's also, when we talk about immunizations are, there are 6 companies now that have immunizations in stage 3. Mm-hmm. Stage 1 is where we make sure it doesn't kill people. Stage 2 is where we make sure it works. But those are real small groups, like we talked about small sample sizes before. Right. So stage 3 is a much broader test of many more people. For instance, China decided to do stage 3 testing on one of their vaccines by just giving it to all their military.
Right. I read that, yeah. And you said something about that in one of your live streams about Russia too, right? Like they're
So Russia has decided they've got one that's been through stage 2, cleared stage 1 and stage 2, and they're basically releasing that vaccination, that immunization to their entire population. And we can debate whether Russia is going to make that voluntary or mandatory.
Right.
But the fact of the matter is that they're going to, and they're either being really, really smart because everyone's going to be protected and no one's going to have problems, or they're really, really dumb because we're going to see some side effects we didn't anticipate with phase 1 and phase 2 testing. And all of a sudden, either they're not as protected as we hoped, or they have a lot of side effects. It's not unlike the swine flu vaccine in 1976, which turned out not to be a huge swine flu epidemic like we thought. and a handful of people died from, a few people died. A few more people had side effects, Guillain-Barré syndrome in particular, which is a paralysis that usually will resolve over time, but it takes a while. And more than we've seen with any other influenza vaccine. So that's a vaccine that was rushed into production much more quickly than usual.
Speaking of that, really quick, so what's
Yep.
the normal timeline? Like, let's pretend that we had this in a lab and we were studying it and it wasn't widespread and we were going to come up with a vaccine. How long would it take to feel good about that and go through all the trials? Does it vary? Or
Probably 3 to 5 years.
okay,
Now, we do a different influenza vaccine every year,
okay,
but it's the same process. And that's what's really important about the disease is how you process the vaccine so that the vaccine is not going to harm anyone. And influenza, it's a different strain of the flu every year. We do best guess based on what strains we had last year. Most of the time we're pretty spot on. Sometimes we're way off, and so I don't remember when it was, 2011 maybe, that we got an extra swine flu vaccine.
okay,
But the fact of the matter is that over time, the more, and this applies to influenza, the more influenza vaccines you get, the more strains of that virus you've been exposed to now. And every year that vaccine acts as a little booster for all those other strains that you've had, which gives you better protection if there is some sort of rogue vaccine or some sort of different, or some sort of rogue virus, some sort of different strain of influenza that year. The coronavirus, this particular strain, it turns out not to be as severe. It's bad, don't get me wrong,
Right.
but it's not as severe as SARS and MERS
Yep.
that you may have heard about in the
Sure.
past. Their death rates were much higher. But this particular strain doesn't seem to have, so being exposed to other strains of coronavirus doesn't seem to have any protection against this particular strain. And the fact is, we've seen coronavirus in this country every year
right,
for ages. It usually causes a cold. It's
Okay.
one of the cold viruses that we see. There are others, adenovirus, enterovirus, some of those, but coronavirus is one of the ones that's always in the mix. It just doesn't usually cause the degree, the severity of illness that we're seeing with this particular strain. And this particular strain is not as bad as SARS or MERS were. It's bad, but not that bad. The thing that makes it unique, it's a lot more contagious than those two. A lot more contagious. And that's why those two had very limited numbers of cases that actually occurred worldwide, but the death rate was much higher from those.
and we mostly think it's airborne, right? I mean, because at the beginning we were thinking touch, we were using the hand sanitizer, and so now we feel like it is airborne.
So primarily it's airborne, primarily droplets, but can also be spread by aerosol, so droplets have a limited length that they'll travel.
Right.
Aerosols are lighter, smaller particles that will travel much further. But again, part of the severity of how sick you get depends on what kind of viral load you get.
Okay.
So droplets are much more concentrated in that regard. But we also know that this bug can be spread sexually. We know that it can be spread. So you're standing at a urinal next to some other guy and he flushes. It can be spread that way. It can be spread. One of the ways they're measuring how many people in a community have had it is by looking at sewage from those communities.
I read that.
So
Yeah.
it can be spread fecally. We don't like to talk about
Right.
diseases that get spread that way, but because it's gross to think about what really happens.
Right.
But it can be spread any number of different ways. Touch, yes. It's interesting. Hard surfaces are probably actually more contagious than, say, a porous surface like a chair, a cloth chair.
A plastic, right? I read that.
So we traded out our cloth chairs for plastic chairs, and turns out that was probably not the best thing to do. And we think it's because the cloth absorbs some of the moisture, and the particles die, or the virus dies quicker when it dries out. So, things like cardboard. You talk about the U.S. mail. By the time you get your mail, any virus that was on that mail's dead.
Unless Amazon's using drones to drop them directly down to my house. Then we might have to worry in a year.
Maybe, but again, the viral load's not going to be as great.
No, I'm kidding. Yeah.
No, I know, but it's true.
I mean, they're close. So.
But especially if you're washing your hands good, the main source is by droplet transmission, and quite frankly, when we talk about droplets, it can get into any mucous membrane, so eyes, nose, mouth. But it turns out that this bug is primarily spread by inhaling it through the nose. And so for those people that slide their masks down so they can breathe through their nose better, not a great idea.
Yeah.
Not a great idea. And just, if I may, everyone talks about, well, you can't get oxygen through a mask, and you can't get rid of carbon dioxide through a mask. Remember, this bug can still get through these masks, not very well, but those particles, the oxygen molecule, the carbon dioxide molecule, are about 1/300th and 1/400th the size of the coronavirus. So the point is, they are so much smaller, they get in and out through this material very, very easily. And no one's going to suffocate wearing a mask. No one's going to breathe in too much carbon dioxide wearing a mask. They are very safe that way. Surgeons have been wearing them for hours on end, doing 12, 16, 18-hour surgeries.
Yeah, and when I go up to Denver especially, they're really strict on that up in Denver, and you start to get used to it, if you're not. So I understand what you're saying.
Yeah.
Back as far as vaccinations, and kind of back to that, and I mean, we started talking about that. If the timeline is a little bit greater, if we had a perfect world, I saw that the CDC, I was yesterday or maybe the day before, had released guidance to the governors in a letter letting them know that now again, who knows if it's really going to be here November 1st or whatever. So notwithstanding any kind of political side of this, that seems fast. I mean,
very, very fast.
And I'm a little, I think people are worried. And the last stat I said, maybe said 30% of people would take it. So what do you think? I mean, is it realistic to think we could have one that fast and then it still be safe?
So it is realistic to think we could have one that fast that would be safe, yes, and effective. It's just that longer term testing, not unlike the talk about what Russia has done and what China's done with their military, that longer term testing will be done basically amongst the U.S. population. There aren't going to be enough doses for everyone to have one, so it's okay that not everybody wants one right now. I kind of like that because it beats fighting over them. I think toilet paper is going to be more scarce than the vaccine when it comes out.
Who would have thought that was the thing that was going to go off the shelves? I mean,
not me.
Yeah,
but,
me either.
But people are funny that way.
Right.
I do think that what we'll probably see is a recommendation that we vaccinate the older people that are institutionalized, so nursing homes assisted living centers.
The highest risk?
The highest risk. I think that'll be the first set. The second group will probably be healthcare providers. And then the third group will be older people with comorbid medical conditions like we talked about earlier. And then I think we get to the younger, healthier population in general. And remember, if you go back not that long ago with influenza vaccine, we just recommended that the really old, the really young, and the really sick get it. And then someone said, well, where do those people get their influenza from? And the answer is they get it from young people that don't get as sick when they get influenza that are spreading it to them. And so the last several years, the recommendation has been that everybody get influenza vaccine, because the more people that are protected and immune from the disease, the less people there are to spread it to other people. And so I do think there will be a push for everyone to get this vaccine at some point, when we have enough to go around to everyone. And that's 331.6 million doses, I think, except it's going to be a 2-dose vaccine, and so that would be twice that, whatever that number is. But it's going to be a 2-dose vaccine. I think they're doing them a month apart, 2 to 4 weeks apart, something like that. And so will I be the first person in line to get the vaccine? No, but I'm going to be pretty close to the front of the line. That was going to be my question,
so you preempted me and asked.
I'm going to be toward the front of the line because I fall into some of those risk categories.
Yeah.
I'm over 60. I'm overweight. I got a little bit of asthma. Those
you
things,
start weighing those risks and that.
Yeah.
Okay.
Yeah. So I will get the vaccine because, again, by the time the vaccine gets to us, it will have been tested, and the only thing we won't have is the length of time that we normally do those. We'll still have the numbers, we'll still have all of that. We just won't have the years behind us that we do with some vaccines. So I would say that it's going to be relatively safe to do. Again, the honest answer is always we don't know, but
right.
I can tell you that about any new vaccine that comes out. When the pneumonia vaccine came out 40 years ago, we didn't know. 40 years later, we got a lot of data about how safe and effective it is. But when it came out, all we had were the 3 to 5 years of research and development that had gone into it prior to that. So that's being compressed, but I still think it's going to be a reasonable thing in terms of safety. And I hope it turns out to be effective. It's probably going to be safer. It's the effectiveness that we're not sure about and won't be until we get people out there and about that have had the vaccine.
Improved that it.
Yep.
Okay. Yep. Do you have time for just a couple more?
Sure.
What about school and kids? And this is a tough question, right? Because a lot of kids that go to school get their love at school. Those teachers are awesome, and that's maybe they don't have families with people that are loving them, that are teaching them. Rural areas, anywhere, right? It's inner cities. So that's a tough one. Did we go back to school too soon? Or, do you feel like if and again, that might be too tough, but what's your take on that as far as kids and schools and even maybe college and sports?
So I'm a big sports buff, and I'm missing my sports. But I think we've seen at the professional level that there are ways to play sports relatively safely. The problem is that professional athletes may be just a tad more responsible than college athletes, maybe a lot more. But you still hear about some of them going to parties and getting sent to their room, quote unquote, to be quarantined for a while. So I do think there are ways to do it better. There's no way that's 100% safe. And I'll say the same thing about going back to school. I do think, and I wasn't sure about this early on, especially when they closed the schools in the spring. But I've decided that social interaction that we get at school is really, really important to our growth and development and to our emotional maturation. And I think that those things are really important. And I think we can do school safely. And you see schools that are doing it safely. Mm-hmm. And I know I'm from Lyman, and so I'm a Badger and all of that stuff. Sorry, Cougars.
Sorry,
I like you guys unless we're playing you, okay? But Lyman has really done a good job, and they've struck that balance. And the cool thing is that with kids especially, not necessarily with an old fart like myself, but with kids, they are so much better at the electronic media and being able to do things online. So if you need to pull them out for a quarantine, for instance, they can do that. But then they can be back in that classroom. And I do think that we're probably, at least until this is well behind us, we're probably going to be looking at some combination of in-person and remote learning. But I think kids are a lot better suited to that, like I said, than someone like myself. I was so much, even for my ongoing medical education, I do so much better sitting in front of someone, talking to them, interacting with them. And, you put them on a television screen and I become a zombie all of a sudden. And it's like, oh, am I learning any of this? But kids are a lot better that way. So I do think that experience of being back in the classroom and having those teachers and getting love from not just the teachers, but from their fellow students.
Yeah.
Or bullied, which we can talk about.
Yeah, no,
that
I get what you're saying.
Too, but,
or even sports, like kids playing sports.
Yeah,
I mean, yeah.
Lyman's got a great golf team this year. I'd much rather be playing football. We'll see how that all works out. Again, I think there are ways to do, regardless of how high risk a sport is, I think there are ways to do it safer. Not that anything is going to be 100%, but I think there are ways to do it safer, and I think we should continue to look at those ways and do those things and explore those things. One of the things that I'm really excited about, I think it's Abbott, has a rapid test. It's a lot like the influenza test, and it takes about 15 minutes. And when I say influenza, also a lot like the strep test we do in the office. It takes about 15 minutes. It's supposed to cost $5, which probably means it'll cost 50. But and it is a test that is so we talk about antigen and antibodies. Antigen is the actual virus itself. This is an antigen test. This tests for the actual virus, and it's about 97% sensitive and 98.5% specific, which sensitivity just means if you're positive, you really do have it, and specificity means if you're negative, you really don't have it.
Gotcha.
So it's a really good test, high quality test in terms of accuracy. And I mean, you could make an argument that if we don't have enough of the tests right now, but if we had these tests and we tested every kid before a game, they're not going to infect anyone.
Is that like a blood swab or what kind of
It's a nasal swab.
nasal? Okay.
It's a nasal swab.
Gotcha.
So, so that's not realistic right now. Might be in the spring when they are going to play some of these sports.
I know, yeah.
So, but yeah, keep your eyes and ears open for stuff like that.
The flu, we're hitting flu season right now and colds,
Yes.
and it's confusing again because everyone, if you start having symptoms, you're like, man, is this COVID or whatever? So that would be good if the Abbott test was coming along quicker. Are you worried about flu being any worse or making COVID worse, or is it just there's not a lot we can do? I mean, because we're already wearing masks, so maybe that'll prevent some of the flu spread. Or
It's been interesting. So if you get sick, you have COVID. There are no other diseases out there right now. That's a lie.
Right.
I'm laughing. I know you can't see it because I'm wearing a mask.
no, we
but,
can see.
So yeah, it's going to get more confusing really quickly. One of the things I'm doing is I am encouraging my patients to get their flu shots, and I'm encouraging them to get them sooner than they might otherwise. So if you got a flu shot available to you, go get it. That said, influenza isn't going to be any worse, but I'm pretty sure if you get influenza and COVID, that's not going to be a good thing.
Right.
We don't know, but I'm pretty sure it's not
So
going to be
you could
a good
actively
thing.
get both of those at the same time.
Oh yeah,
right?
oh yeah. They're spread the same way, so yeah, you could get them both at the same time. But you're right. I do think that what we're doing right now in terms of wearing masks, washing hands, social distancing, some of the precautions we're taking now to prevent coronavirus will decrease the number of cases we see of influenza, strep, even the common cold. I think we're going to see less of a lot of those things than we have in other years. We're still going to see them, and again, you don't want COVID with anything else.
Right.
You just don't want
it.
COVID,
Yeah,
period.
With a side of something.
But,
I gotcha.
So.
Okay. As far as you guys have done a really good job up here, I think it's weekly or bi-weekly. You guys are doing a live stream where you guys are sitting down in this actual room and you guys are talking about what's going on. What prompted that? I mean, how did you guys decide to do that? And we're going to make sure we put a link to that when we post this video so everyone can see that. What prompted that? And are you going to keep doing that?
That probably is because we have a public relations officer here who thinks we should be sharing with our community.
Megan Mosher?
Mm-hmm.
Okay, cool.
The boss supported it. You don't do anything without support from the boss. And there were others of us, Joe Beth, our county health nurse, myself, Dr. Brianna Fox, who, by the way, we're not related, just for the record. But I'd claim her. It's not a problem.
Right. Well, and everyone says Dr. John Fox, and you start thinking Broncos, right? So.
Yeah, no. I'm from Ohio. Did I mention that earlier?
Oh, are you?
Anyway,
Okay.
yeah, you guys broke our hearts.
Cleveland.
Cleveland Browns fan, yes. But no, so there's been buy-in really from the top down, and that's what has allowed us to do it. And we debated whether we should continue it, but there's still been a fair amount of interest, and there's new stuff all the time. I mean, that's this folder that I have with me. It's a middle folder. It's a couple inches thick. There's new stuff all the time, and that goes into this folder. I've got one of them digital file thingies on my computer that's got a bunch of stuff in it. But I do much better with paper, obviously. So, I keep track of the statistics, both worldwide, both within the United States, within Colorado, within our local counties. One of the, just to kind of give people an idea how infectious this disease is. India, it took them 6 months to get their first 1 million cases. Took them 30 days to get their second 1 million cases. And it's taken them 16 days to get their third 1 million cases.
Is that where they're at right now?
That's where they're at right now, 3 million, yep. Yep.
Do you know how many cases are we at?
The United States, I've got the stats right here. U.S. is 6.1 million cases, 186,000 deaths. Colorado's done a pretty darn good job. We're right at 58,000 cases with 1,952 deaths.
And that's still up if you were to look at deaths year over year?
Yes, it is.
Okay.
Yes, it is.
Okay. And as far as any messaging or anything we haven't covered that you think would be important to get out to the folks of Eastern Colorado, or whoever watches this, Colorado, wherever?
No, the thing that I think makes more difference than anything else we're doing is wearing masks. And it doesn't just protect you, it protects other people. And so if you care about anybody else, wear a mask. If you don't bother. I mean, it's okay. Some people just don't care about other people. But if you care about other people, wear a mask to protect them. If you care about yourself, wear a mask to protect you. They work. They make a difference. And I think that until we have a vaccine that's working, masks are our number one tool at preventing and decreasing the spread of this disease.
It's not, and it's not very expensive. I mean, so I get what you're saying. I mean,
well, and you can make a cool fashion statement if you want. I love to fish. I got fish on my mask. I got other masks that have flags, eagles. I got one that's got a fox on it. And then I got a boring maroon one and a boring gray one. But you can get as cool as you want with these things. My daughter, who's I'll put a plug in for her.
Sure.
She's a veterinarian, and she's got one that's a tiger. It looks like a tiger face, and she's got another one that she's a big fan of Dobermans, so she's got one that's a Doberman. So you can have fun with it too. I mean, it doesn't just have to be about the drudgery of wearing a mask. Believe me, I will be the first person to ditch this when it is safe.
Right.
Because it's not a lot of fun, and I like facial expressions. I convey a lot of my thoughts through facial expressions.
Yeah, me too.
And I'm not as good at it with a mask on. But until that time is here, I'm going to wear a mask to protect you and to protect me.
Do you think you alluded to the first couple months when we were told not to? Do you think that was either incompetence or was it calculated because we were worried about responders, and maybe it just wasn't handled, the messaging wasn't handled correctly to say, you know what, guys, we don't have enough, and we don't want panic, but we want to make sure the ones that we do have are going to our front lines.
I don't think it was, I think it was calculated.
Okay.
I think it was calculated so that we would have enough masks in the medical profession to protect ourselves. Masks there were plenty of masks, but there weren't enough for a pandemic.
Right.
And if you listen to what the people that were saying don't bother with masks, don't wear a mask, it's not going to protect you, and we're saving them for the healthcare providers. Think about that. Use your brain and think for just a minute.
Yep.
If they work for healthcare providers, why wouldn't they work for me? But if we say that, if we had said at that moment that masks help, if we said what we know now for a fact, masks help, but don't go buy masks right now because we want to save them, or just buy one mask.
Just like toilet paper.
That's exactly what would have happened, and that's human nature. I get that. I don't have any issues with that. But it was the wrong message. It was the absolute wrong message to send. And the fact is, it didn't take us too long. It seemed like a long time, because everything seems like a long time right now. But it didn't take too long until the numbers were up. And then we started saying, oh, now we have enough masks. You should all be wearing masks. Mm-hmm. But by that time, the damage is done. And then it becomes a political tug of war. And
Well, you think we're only 6 months. I mean, I know it seems like a long time, but it's 6 months.
It hasn't been 6 years?
It hasn't been 6 years.
Oh,
So,
okay.
but, well, I really appreciate it. I mean, your transparency, your willingness to sit down with us, it means a lot. And to everyone out on the Eastern Plains, whoever gets to see this, you didn't have to do this. So thank you for doing it. And hopefully we learned a lot about it. And thank you for continuing to have these messages weekly, because we're going to make sure we get it out and amplify it. And I know that it makes a difference.
It's my pleasure, and I really appreciate you for asking me on. I don't know everything.
Right.
Nobody does, but I try to learn as much as I can about it. I try to stay up to date, and that's the great thing about medicine. What is the best and greatest today? Why the heck did we ever do that tomorrow? And that's just part of the deal. And it doesn't bother me to tell you that, but it's my job to be honest and say, hey, what we told you, it ain't true. This is what's true now. And, oh, by the way, that might not be true next year. We may change it again.
Yeah, you're not perfect. I mean, you're figuring it out.
So that's my job, is to know and to share that information, and I'm more than happy to share that information with whoever is interested in it.
Okay.
So thank you for having me.
Definitely. Thank you, Dr. Fox.
No problem.
Okay.